If you can stay home, that's the best place to be, is to stay home. Hunker down, turn on your Netflix, watch some miniseries, whatever you can do. Oh man, and just stay home, and that's the best way to try to get this under control and flatten that curve.
And then I think Krista might be able to answer this. Should if the nurses that are treating these patients that are currently confirmed positive, what are some of the directives that you or anybody else is given on whether they should go home or whether they're being quarantined or what's going on with them?
So we have procedures in place, and what we did was we said if you are not comfortable going home, we have arranged a place for them to sleep here. We have showers for them. They're getting their extra scrubs. All of them keep those in their lockers so that they don't even have to leave the building if they choose not to. But we do properly train our staff in how to don the appropriate PPE and how to take it off so that they are all very comfortable in knowing that when they leave a patient's room, they are leaving the bugs in the room. And then, of course, doing their proper hand hygiene. But if they don't want to go home, we're not asking them to. We are providing that for them.
Hey, Kristen, I'm sorry. Just to be clear, I'm not sure of the proper terminology, but PPE, the uniform or whatever it is that they're wearing when they're treating these patients, I'm guessing is a large upgrade from what they would generally wear in a normal circumstance.
It is. One of those things we do is you've got your mask, your gloves, your goggles, you have a gown on. Several of them are wearing their hat protective covers so that every piece of their body is completely covered when they go into those rooms. And some of our physicians actually have the plastic suits that they wear as well.
Thank you.
And that's also been a big part, is these ladies and gentlemen out there that have been making these masks for us. Thank you again. Thank you for what you're doing. Keep sewing them, because we're going to need them. It's providing a good resource for our folks, and those people at that level of exposure are able to wear those, and it's been a big help for us. So for those who did that, for Dr. Armstrong, who in our building kind of got out in front of that, thank you for that. And all the church ladies and everybody sewing, thank you, and keep them coming. Yes, sir.
Regarding the masks, are they asking for donations to buy materials or anything like that?
Yeah, I mean, I think we'll take whatever we can get right now. And I think that's not just for us, that's probably for any facility in this area, that there's a limited number. We're all working to work many angles to get more, but if we can find supplies to manufacture those, these ladies sewing them, washing them, ironing them, bringing them to us, bring them on, because we'll find a place to use them.
Where can someone that wants to donate, where can they bring their money to or make a contribution?
Yep. United Way is one.
Yeah.
The Medical Center Foundation is we're running some through there too. So if they want to reach out to our foundation, they're set up to be able to do that and give the proper paperwork so they can all that can be done. But man, come on, bring it. We'll take it.
Through the emergency management plan, the United Way is the party that is designated as the nonprofit to help with a lot of those donations that come in through our community, and that's who it's through.
All right.
I have two last questions. Can you tell us how many presumptive positive cases we have?
Presumptive positive cases. Anybody want to?
So those are the numbers that he read earlier. So we have 14 that are pending approval to be sent off, and we have 11 that have already been sent off, and we're waiting on their results.
Okay. Another question. What are the steps the tests go through once they leave the hospital?
Yeah, the tests, once they're collected here, there's some legwork that goes on behind the scenes even before that happens. Then it depends on which way it goes. If we send it through the health department and through the state's lab, there's a process through there to make sure they meet the criteria. We get a tracking number, we get an ID number, then it gets approved off, and off it goes. Through the private labs, it gets approved by a doctor with a doctor's order, it gets collected, we ship that off, and then it goes to that lab. So either way you go, there's steps for both of those. So through the state level, there's a few more steps because there's better tracking, and you can imagine the amount of tests they're getting, what they're having to do to keep up with those and to keep those going to the right place. So there are more steps through there, but they're all appropriate, and that helps us keep good records of who's getting tested and who's positive and who's negative.
And I'm sorry, sir, very last question.
You said that was your last one a minute ago.
Just to put minds at ease, any patient that tests positive for the coronavirus, are they being released back at home if they are, let's say, in dealing with it in a healthy way and seem to be able to get over the virus themselves, are they asked to self-quarantine at home, or are they all just kept in the, if they are positive, do you anticipate anybody leaving this hospital until they are no longer symptomatic?
Yeah, I know that there are positive people that are at home right now. I know that. And that's not just here, but that's all over the world, the United States. And I think that that's proper, because if they are able to handle this at home and they're able to treat themselves, that's one less bed being taken up for somebody who is more emergent that person's not filling. So I know that there are positive cases at home. There are people who don't even know they're positive. They're taking care of themselves at home. So I would say, yes, that is happening. And they're not going to get released from the hospital till our doctors say they're ready to go. But at the same time, we want to make sure we have enough beds for people who are sicker and that need that spot. So there are people that are managing themselves at home.
Sorry, adding to that, what determines when a person is in severe condition? Like, do you guys have?
Wow, that is probably out of my pay scale. Anybody want to answer that?
I'll let Dr. Benton speak to that.
Okay, great.
So we bring them to the hospital when they're no longer able to care for themselves at home. That may be like oxygen requirement, or if they need additional support, maybe intravenous fluids, things like that. But if they're otherwise stable, they can care for themselves at home.
What's the follow-up after someone is discharged from the hospital?
I follow it like when we tell them to come back.
Make sure if they're not contagious or...
Sure. So yeah, we would, their primary care physician would reach out to them, hopefully keep track of them, but also we would see them back in our offices at appropriate times.
And that's mandatory, right, for that, since they...
Well, we would keep track of them, and they will also be tracked through the health department as well.
Thank you, Dr. Benton. All right. Anything else? Have we got everything covered we think we need to cover? Are y'all okay? Docs, y'all okay? Just again, we just want our community to know that we're ready. We've been ready. If our ready's not ready, our contingency's ready. We've have things in place and have had them there for a while, and we're ready to attack this head on, and we'll take care of the patients. Again, to our community, stay home, wash your hands, be careful, assume that you are going to be exposed, and stay home and take care of yourself. And again, don't forget to pray for your neighbors, pray for us, and pray for this community. If nobody has any questions, we'll wrap it up. Anybody else? All right, thank you. Have a great evening.
Thank you, sir.